to listening up. Today I'm going to talk about the new CPR. Circulation, the medical journal from the American Heart Association, came out in October of 2010 and said, folks, after 50 years of CPR, we need to do things a bit different. Let me give you the real quick lowdown in the next few minutes of this podcast. If a person is unresponsive, what should you do? Well, first check if they're breathing. That is, if they appear lifeless, they don't move, you shrug them on the shoulder, you tap them, they don't respond, and then you check and they're not breathing, and gasping is not breathing, folks. Look for someone to help you. Call EMS and get an AED. That's an automated external defibrillator. An AED applied fast may restart the heart. Don't worry, AEDs are user-friendly. They have audio and visual prompts. Now understand that when a victim's heart has stopped pumping, what happens? There's a cardiac arrest. Permanent brain damage can begin in 4 to 6 minutes. You must act fast. You have to know that cardiac arrest can happen at any age and may be caused by many conditions, not just heart attack, suffocation, allergic reaction, drowning, choking, electric shock. So if you're untrained in CPR, and I advise everyone to take a CPR course, but if you're untrained and you call EMS, what a dispatcher will tell you is, and what you'll learn in a course is, do chest compressions as soon as you establish that someone's unresponsive and not breathing. You've got the person positioned flat on a firm surface, you've opened the clothing, you're kneeling, facing the victim's chest. Use the hand nearest the victim's leg and locate the center of the chest. That's between the nipples on the victim's breastbone. You place the heel of the other hand on top of the hand that's already on the chest. With your shoulders back, straighten your arms, lean over the person, and lock your elbows. Use straight down pressure through both arms to push the breastbone down towards the person's spine, at least 2 inches. You're going to push hard and fast at a rate of about 100 per minute. You've got to let the chest recoil between compressions. And don't stop compressions unless absolutely necessary. An AED comes, EMS comes to help you, or another person volunteers who knows CPR to help you. This is called chest compression only CPR. Now remember, if you take a CPR course, you're going to learn about breathing for someone and the difference in doing CPR for infants versus an adult. And all of this is learned best in a CPR class. So the new CPR is not ABC, it's CAB. Start with cardiac compressions, chest compressions, quickly when you find someone unresponsive and not breathing. And please, take a CPR course. This is DocHandal. Thanks for listening up.